Hello, my name is Madison Kinsey, and today I'm going to be talking about the drug compounding problem in veterinary practices and my proposed solution for this problem. So, first and foremost, what is drug compounding? So, essentially, drug compounding is the process of combining, mixing, or altering the ingredients of a medication to make it tailored to the specific needs of a patient. So, examples of this include customizing the dosage of a medication, adding flavor to a medication, like maybe making a liquid medication grape flavor so it's easier for a child to take, or adjusting the formulation of a medication to make it easier to take. Again, that would be like taking a medication from a pill form to a liquid form so it's easier for somebody who has a hard time swallowing pills to take. So, what's the problem? So, first and foremost, as I was stating before, drug compounding really isn't just a thing that's strictly reserved for veterinary medicine. It's also used in medicine for actual people. But I'm going to focus on the problem of drug compounding in veterinary medicine because that's really where it's an issue. So the problem is that veterinarians don't have enough access to drug compounding. Like I said before, drug compounding is when they change the formulation of a medicine to make it tailored to a specific patient. So this process is very necessary in the profession of medicine, and without it, veterinarians can't provide adequate care for all their patients. So the reason that there are so many restrictions on this process is because there was an incident in 2012 in a pharmacy where compounded drugs ended up being contaminated and ended up killing a lot of people. So that's when the FDA really decided to crack down on the process and pass a lot of rules and regulations to limit the access of drug compounding. So it is not FDA approved for this reason. So attempted solutions. Unfortunately, there haven't been a lot of attempted solutions for this problem because drug compounding is not an issue that really affects people who are not veterinarians or own pets. So, like I said before, there haven't been many solutions to fix this problem. But there was one that I researched. It was happening in November of 2019. The FDA was discussing the passing of a possible bill called GFI number 256. And basically, what this bill would have done was it would state instances where the FDA would and would not enforce bulk drug rules when it comes to drug compounding. So basically, bulk drugs are banned completely in the process of drug compounding, and this bill would have basically loosened those restrictions and said what drugs you can use, what you can't use, how much you can use of it. And this would have been really big for veterinarians because you really do need both drugs to make some of the compounded medicines. But unfortunately, I couldn't find any recent things on this bill, so I don't think anything really came of it. So, an overview of my solution. So, a conversation slash multiple conversations need to be held where multiple people from the FDA and veterinary organizations come to an agreement on drug compounding regulations. There also needs to be extra training or educational classes where veterinarians can learn more about the process of drug compounding and the new regulations that will be put in place after the FDA and the people from these veterinary organizations talk. The reason that these classes and extra training needs to be held is because a lot of the issues with drug compounding, a lot of the incidents that happen that have made it so these restrictions are in place, a lot of times is because somebody is using it incorrectly or when it's not needed, or they just really don't know a lot about the process, but they still try to do it, and then it ends up in somebody or an animal getting hurt. So, with these classes and the extra training, there would be a very slim margin of error for this because you would have been trained on this process. So, the steps to my solution. So, first of all, step one, the FDA must express that they are willing to discuss a possible solution to the problem. Since they are the ones who put the restrictions in place and they have the power to loosen them, they're really going to be a big factor in putting the solution into motion. So, step two is that individuals that are willing to represent the veterinarian side of this need to step forward and volunteer. Organizations that really advocate for veterinary rights and animal rights, such as the AVMA and the AHI. And there could possibly be room, if we don't get enough organizations, for maybe some regular veterinarians that just have really been affected by the regulations to step forward and volunteer to be a part of it. So step 3 is that the event must be put into place. There needs to be a discussion on whether it's going to be a private conference or maybe a public panel where people who are veterinarians or who are affected by this can come and step forward and ask questions and really state their opinion on it. And then step 4 is the solution will have to be executed. There will have to be multiple meetings held to discuss this agreement, and it won't be an easy and fast fix, but it doesn't need to be an easy and fast fix. It doesn't need to be an easy and fast fix because these people really need to take their time on coming to a feasible solution that will really help out veterinarians and these animals. So step 5 is the group will come to an agreement by possibly voting. And step 6 is the solution that has been agreed on will have to be actually implemented. It will likely have to be tested at certain clinics or labs to ensure that it's safe and effective, because you don't want to just put it out there and then there's a bunch of people who are reporting that it's dangerous. But after these trial runs are over, it will be the public will have access to it. So step 7. Required training on drug compounding will need to be provided. So, as I said before, a lot of the incidents that have happened with drug compounding were really just people who really didn't know how to use the process. So there needs to be training on the new regulations and the old regulations, what they are, how to use them, what you can and can't do, because this is a big part of it. You don't want to be doing something that is not FDA approved, because then FDA may be able to step in and take it all away, and that's not what we want. They also need to know the basics of the process so they know what they're doing, how to safely use this process, emphasis on the safely, because that's really what we're shooting for, and when it's okay to use it so that you're just not unnecessarily using drug compounding when it's not needed. So here's just a timeline of those events. So step 1, the FDA will initiate the plan. The people who are willing to represent veterinarians will step forward. Step 3 is the event is put into place. Step 4 is the solution is executed. Step 5 is the agreement is decided on. Step 6 is the solution is implemented. And step 7 is the educational courses are provided. So the feasibility of this solution is it is actually very feasible. There are certain funds that would have to be covered, such as the cost of renting the place to hold the conversation, if that's the direction they go in. The cost of the extra materials, because there would be more materials that would be allowed to be used in the process. So, and then the cost of the classes, and then training to make sure that the veterinarians know exactly how to use it. So it shouldn't be a difficult task to cover these funds. People could step forward and donate and things like that. And it will not be a quick and easy fix, but with the help and effort of everybody involved, it is attainable. So, drug compounding has been a problem that has been plaguing individuals in veterinary medicine for far, far too long, and it's time to put a much needed solution in place for this problem. For both the animals that are affected by this problem, the owners of these pets, and the veterinarians who have to deal with this issue daily. It will not be an easy process, and it will be long, but with the help of the community, your help, and everybody else, there could be a long overdue solution to this problem sometime in the near future. And here's my reference page. Thank you.